Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over a pain assessment and management and using different tools for, especially in children, where it's a little bit harder. We can't just give them a scale. Hey, on a scale of 0 to 10, 10 being the worst pain you've ever experienced, what is your pain? Right? It's a little bit harder with children. So I'm going to go over some tools that we can use to assess pain. But first, if you could hit that subscribe button, it would be greatly appreciated, as it does help my channel reach more people. And that's what it's all about. So let's get started, guys. So why are pain assessments so crucial? So for proper pain management and for pain management to be effective, we need to assess the pain. So nurses are in a unique position because they spend the most time with the patients, okay? So one of the top things that people experience in hospital is pain. Okay, so acute pain is associated with tissue damage and an inflammatory response. So pain is a multi-dimensional assessment and therefore must include intensity, location, duration, description, the impact on activity, and factors that may be influencing the child's perception of pain, okay? It is a lot more difficult to assess a child for pain, okay? The influences that may alter pain perception and coping strategies include history or issues, cultural, religious beliefs, past pain experiences, their first pain experience. In addition, family response to the child's pain can either have a negative or a positive impact, okay? We've all seen it where a child gets hurt and so somebody goes up to the child who's not the parent and is helping the child, and they're not crying or anything, and they're all fixed up, and then all of a sudden they see their parents and just bust into tears. Okay, that's exactly the same with pain. It can either have a negative or a positive effect, how the parents interacting with the child. Okay, the guideline specifically seeks to provide nurses with information regarding indications for pain assessments, types of tools used for pain assessments, and documentation of pain assessments. So a pain assessment is a broad concept involving clinical judgment, okay? So we do have to really use our clinical judgment based on observation, significance, context of the individual's pain experience. There are definitely challenges when assessing children or pediatric pain, okay? So we need to be using psychological and behavioral tools that are used in place of the self-reporting of pain, okay? So, however, children with developmental disabilities, we can sometimes make incorrect assumptions. So we need to be using information and cues that are identified and given by the parents or caregivers. We need to incorporate them into our assessment and see if this is regular behavior or behavior even when they're out in maybe stressful situations, right? So sometimes it can be difficult for us to assess. So you have to be using the parents and caregivers to help you. Pain assessment in infants and children's is challenging due to the subjective and multi-dimensional nature of pain, okay? We need to depend on others, like I said. In some children, it can be difficult to distinguish between pain, anxiety, and distress, okay? Assessing and documenting pain is needed. You have to put as much information as you can about your pain assessment when documenting. This will help improve management of pain. And if it's actually coming from anxiety or distress, then we're recognizing it right away. Okay. When assessing a child's level of pain, careful considerations that are needed: cognitive ability, environmental, they are at a hospital. This is a stressful situation for them. Anxiety, the cause of pain. Is it post-op? Like what is causing their pain? Pain measurement. So you should be considering these points, especially on their admission. So a pain history, location of pain, intensity of pain, cognitive development and understanding of pain. Okay, so right when they come in a patient's admission, we need to be looking at all of these, especially if they're coming in for a surgery. This is great because we see them come in. Okay, we have a good idea of what's going on, and we can get that pain history. Is it something that they've experienced before? Location of pain, intensity. Okay, so we need to be looking at all these things. So when are we assessing pain? So pain scores should be documented at least once per shift. Okay, now children with pain, so if they have a pain score, it needs to be documented more frequently. So children who are receiving oral pain medication should have their pain scores documented at least every 4 hours while awake. Okay, assessing and documenting pain before and after the medication has been given, and document the effect. Okay, are we giving enough? Is it covering their pain? We want to make sure that we are assessing after the medication has been given. Assess and document pain on activities such as physiotherapy. Okay, so maybe they don't have pain while they're lying down, but they have pain while they're doing physiotherapy. So we need to be documenting that also. Okay, so now we're going to go over the different assessment tools. So this first one here is called FLACC. FLACC, face, legs, activities, crying. 1 second, my dog. All right, let's try that again. Face, legs, activity, crying, and are you able to console them? Okay. So this is normally used for children 2 months to 8 years of age, but it can be used in those up to 18 years of age with cognitive impairments or developments. Okay. So once again, sometimes it is hard to assess a child with cognitive impairment or who are nonverbal. So you want to be asking the parent or caregiver to explain their child's pain behavior. Okay, so involve them as much as you can. Here's the little chart here. So there, each one is rated 0, 1, 2. So it gives you a pain score between 0 to 10. Okay, so you're just going to kind of circle which one it might be. So face, are they having any expression? No expression? Or do they have grimacing, frown, withdraw, disinterest? For 2, frequent to constant frowning. They're clenching their jaw. Their jaw might be quivering. Okay, so you would circle which one they have. Legs, are they in a normal, relaxed position? Are they uneasy, restless, or tense? Kicking, drawn up. Okay, are they clenching their legs? Activity, lying quietly, normal position, moves easily. 1, squirming, shifting, back and forth, tense. Arched, like, are they jerking around? Are they moving a lot? Like, what's going on with their activity? Okay. Crying, no crying, awake or asleep. 1, they're moaning or whimpering, occasional complaints. To 2, it's a steady cry, screaming, sobbing, frequently complaining. Now, can they be consolable. Okay, so either they're going to be content or relaxed. Can you just touch them or talk them through it? Are they difficult to console? Okay. Or comfort. So you just base it on this, and then you get a scale of 0 to 10. Obviously, 10 is the worst. Okay, so next we have the Wong-Baker faces. This is normally used from 3 years of age up to 18 years of age. And then you just kind of explain to them that this is for pain, and happy means that they have really no pain at all. Now, 2, they would have a little bit of pain, but they're still okay. 4, a little bit more. 6, a little bit more. And then 8, like it's hurting a lot. And then 10, it's the worst pain, and they could be crying. They don't have to be crying, but it feels really, really, really bad. Okay. So then they can pick which face best describes them. Now, normally starting at the age of 8, you can use self-reported, just the numeric rating scale of 0 to 10. So 0 being no pain, 10 being the worst pain that they've ever felt. And like I said, we can start this at 8 years of age. And then they just give you a number of where they're feeling at. I still like to use the faces at this point, but you can describe it in a way that, okay, 0 is no pain, 10 is the worst pain. Where are you at this? But I feel that when they see the faces, it helps them out a little bit. It gives them a little something to pick from. Okay. And it just I find that I get a better rating, and then I can treat the pain more appropriately. Okay, so we do have physiological indicators. Now, these cannot be used just by themselves to measure pain, but they do help incorporate and assess the pain. Okay, so heart rate can increase, respiratory rate, their pattern may shift from normal to increase, decrease. It can change patterns. It might be kind of all over the place. Okay. Their blood pressure can increase, their oxygen saturation may decrease. Okay, and like I said, we can't just use this as the pain measuring tool. We have to assess, but this is a good indication also when we're assessing. So taking vitals, especially when they're in pain, and then after, when we go to do our reassessment of the pain medication, we're retaking vitals and seeing if things are kind of equaling out. Now, key considerations: assessing pain using a developmental and cognitive appropriate pain tool. Okay, so you have to use, once again, your clinical judgment. Nursing is so much clinical judgment. So you just use your clinical judgment on which one you see fit. Okay. Reassess pain after interventions have been given to reduce pain. You want to reassess. Okay. Assess pain at rest and on movement. Investigate higher score pains. Okay. So if a child is telling you that they are a 10, but you're not seeing any of those signs, you gotta kind of investigate a little bit. Document their pain scores. Okay, super important that we're documenting pain and everything about pain. If you have like more questions, if you're unsure of the questions you should be asking, use your PQRSTU assessment with pain. Okay, if you're not sure what that is, I'll link it up above. And then use your parents and guardians. Okay, the parents and guardians of the child. This will help you. Okay, they know the child best. It's hard for us to go in and assess the child's pain, especially when it's so multifactorial. Okay, so make sure that we are involving parents and guardians. So I hope this video did give you a better idea of how to assess and measure pain, especially in children. Now, for adults, we're just using the scale of 0 to 10, but sometimes we do need these other ways to measure also with adults. So once again, use your clinical judgment. I hope this did help you to better assess pain, and I hope to catch you in my next video, guys. Bye for now.